experiences, and thank you for that. I just want to take a minute and share with you kind of my thoughts. We heard tonight a huge range of issues, starting with the youth and mental health issues. I want to express my appreciation for that. And I can tell you that in our office, in our constituency office, my staff and I hear almost every day from parents who have children, youth with mental health challenges and issues, and there are the waiting lists. I can't even begin to tell you. Even to get an assessment is about 6 months, and to get treatment is a year to a year and a half. We have a serious problem, and we need to address it. We heard the challenges of accessibility, and this is an entire dimension that very few of us have any direct experience with. But we've heard from some very courageous people in our community tonight who have come forward to say, hey, hear us. There are some real challenges, and something that I wasn't aware of in terms of the accessibility issues even within our own hospital. And that is something that we need to address. The hospice services. Again, the economies of scale, the cost-benefit analysis, when you consider, first of all, the quality of life that is at stake here, and allowing people their wish, and that is to spend their latter years and days at home as opposed to being in an institution. We have an army of volunteers who are willing to make that happen, but without question, there is a gap here as well, and there need to be some financial resources, and doesn't it make sense, what I'm hearing, for the healthcare system to invest cents, really, compared to the millions of dollars on the institutional side, and it's something that we have to look at. Tyler, our quadriplegic friend, Brock, shared their personal circumstances, and again, it's a matter of where do we put our resources, and we can spend the multi-millions because it's easier to do, as opposed to seeing the vision of creating an appropriate facility where people can be looked after. And my friend Bruce, who dared to cross that barrier and actually begin to talk about some of the other alternative ways of being able to deal with the funding issues of healthcare. Ronan shared his personal experience, and I'm sorry to hear that, because what it means to me is that in this room we have people whose needs are not being met, and are still not being met. And that, within the context of our community and our amazing healthcare system, is something that is really difficult to accept. So thank you for sharing your thoughts. The convalescent care, the long-term care issues. I think that what we heard there is the rigidity of the rules that enter our healthcare system, which has become so bureaucratic in many ways that we can't see the solution, because all of those pyramids and all of those silos are there, and if you don't fit into a particular box, then we can't do it. We'd rather pay thousands and thousands of dollars to have somebody in a convalescent bed, as opposed to reimbursing $750 for the rental of a bed or a wheelchair or whatever it is. And it's a real lesson to us. Out-of-country issues. I still remember that telephone call. I believe it was 12 o'clock, 12:30 in the morning. And Ms. Adair was on the other end. And my wife said, so who was that? There was a constituent. And this is one of those things that make it so rewarding. And my staff, Neva's here, and Suzanne and Daryl will tell you that what we do, there are some difficult days in what we do, but there are times when you can reach out and help and ensure that people are looked after. There is no greater calling, as far as I'm concerned, on this planet than being able to come alongside and help. And so we did. And then the terrible ordeal that Mrs. Adair and her husband had to endure. And again, people are here tonight, and they're hearing and they're listening, and we have to learn from this. And again, thank you for sharing. And then finally, the wrap-up from my friend, the consulting engineer. No one could have put it into boxes more clearly, and I thank you for articulating that. I'm going to wrap it up, and there was a handout on all of the chairs. If you care to leave us with contact information, we'll put you on our mailing list to keep you up to date in terms of what we're doing here in the riding and constituency office. If you have any other suggestions you want to leave with us, please do. Attached to this, you're probably wondering, why is this organ donation form attached to this? Here's why. I have made it, again, through contacts with constituents who have come to me, I have made it one of my passions to do what I can to raise awareness about organ donation. And we have had constituents come through our office, desperate, and all they needed was an organ transplant to give them life. And they weren't getting it. And, in the province of Ontario, some 17%